After having experienced pregnancy with my first child, I found myself having been stressed out and overwhelmed with concerns from doctors, horror stories from friends, and pressure and fear about delivery. I quickly realized that there was a great possibility that I could have a cesarean delivery. As though being pregnant, planning for the birth of a new child, and worrying about the health of your baby is not enough, doctors seem to be quick to advise you to have a C-section. I then decided to research why this is so. I learned that the performance of cesareans has increased to almost 30%, and after having one cesarean, many doctors will not recommend for you to have a vaginal delivery. In fact, it is almost impossible to find a doctor who will perform a vaginal delivery after you have previously had a C-section. Having been one of 4 children delivered vaginally, born 2 weeks late with the umbilical cord wrapped around my neck, I know that it is very possible to perform a vaginal delivery despite unexpected complications. My mother-in-law gave birth to 6 children. 2 were twins, all born vaginally. Yet, while pregnant with my first child, at the age of 23, having a cesarean was a concern, even without any real complications. This got me to thinking, what are the risks of having a cesarean, and why have C-sections increased over the years? According to Thomas Radecki, C-sections are overutilized. There are significant differences in cesarean and vaginal deliveries. One being the cost. Cesareans are much more expensive than vaginal deliveries. An uncomplicated vaginal delivery can cost between $3,000 to $6,000, while a C-section can cost between $10,000 to $40,000. The second difference is the pain experienced after delivery. Although every pregnancy is indeed very different, it typically takes longer for mothers to recover after giving birth by C-section due to the fact that they are actually undergoing a surgical procedure. Another difference is the effects of each type of delivery to the mother. Women who give birth by C-section have a higher rate of infection, rehospitalization, stroke, blood clots, and surgical injuries. Women who give birth vaginally may experience urinary and bowel incontinence as well as vaginal pain. C-sections may also have an effect on the mental state of a mother due to poor birth experience, less interaction early on with the baby, and a higher risk of postpartum depression. Of course, this may also occur after a vaginal delivery. However, the risk of experiencing such is slightly less. Studies have proven that women who deliver by C-section are less likely to breastfeed, and there are ongoing physical problems that they may incur, such as chronic bowel and pelvic damage. The harm each type of delivery may have on a baby varies as well. Studies show that there is an increase in stillbirths after giving birth by cesarean, and a 23% decrease in fertility for the opportunity to have a second child. Babies born by cesarean can experience mild to severe respiratory problems, possible surgical cuts, and asthma. Babies delivered vaginally may experience brachial plexus injury, which is damage to the nerves. However, that type of injury is typically temporary. After further review of the cons of giving birth naturally versus giving birth by cesarean, that leads me back to my question. Why have the performance of cesarean deliveries increased? I found my answer after doing a great amount of research on the issue. Number 1, complications with pregnancy. There are instances when doctors must perform C-sections for the health of the mother and or the baby. Number 2, there is a major difference in price. $10,000 to $40,000 is very different from $3,000 to $6,000. Number 3, liability. There is speculation that healthcare providers are so worried about being sued for malpractice that they have resulted to increase in cesareans because there is less chance for them being sued. Not to mention 50% of obstetricians have been sued for such malpractice in the past 5 years. Number 4 is the mother's request. Some mothers do indeed want to plan ahead of time and find it more convenient for them to have a date for delivery set in advance. This also works in the healthcare provider's favor as well. They already have a scheduled date and time for delivery for that specific patient. The last reason for the increase in C-sections is the increase in inductions. The rates of induction have increased to almost 44%, and inducing labor also increases the risk of having to have an emergency cesarean. As stated above, every pregnancy is different. For some women, having a cesarean may save the life of their child and their own life. It may be more convenient and completely comfortable with no major drawbacks or issues. For other women, their experience may be traumatic. The same applies with vaginal deliveries. Some women have better experiences than others. There are risks involved in both vaginal deliveries and cesareans. The increase in C-sections is a concern due to the fact that it may have a negative effect on the mother and child. But overall, it is always important for parents to weigh their options and ultimately do what is best for them and their child. Thank you for listening.